Okay, guys, so I wanted to touch base and do a little bit of an info session on what I've been seeing recently. Comes through the clinic quite often is something you guys might have heard of called pickled elbow, also known as tennis elbow. I guess the technical term would be a lateral epicondylopathy, so pain at the outside of the elbow here. So I've been seeing a lot of this recently. People have been coming in complaining about pain on the elbow. But again, it's important to understand what's going on here in order to treat it. This is what I tell all of my patients, like in order for us to understand, or in order for us to improve your symptom, improve your pain, first we have to understand why. So this is why I wanted to give you guys this little deep dive into what tennis elbow is, or pickleball elbow in this case. So pickleball elbow, as I mentioned, is an irritation of the tendon on the outside of the elbow. Now, as you can see on the outside of the elbow, if I wiggle my finger like this, move my wrist up and down, kind of rotate my forearm up and down, rotation this way, you can see the muscles that are moving in there. Now, this is the lateral epicondyle, which is the bone that all these tendons from the wrist wrist extensors to the finger extensors attach into. So this is where they all kind of meet, and no wonder this is the place that really commonly gets irritated when you do any kind of racket sports, or we also see this quite commonly happen with people who are manual laborers. So, for example, people who are using power tools quite often, or manually working on screwdrivers. So see it quite often with chefs and people who use their hands quite a bit for cooking and chopping, for example. Yeah, that's not an exhaustive list. So anyone who really does use their hands quite often, especially with gripping, twisting, rotation type of motions, will have a chance of getting this type of tennis elbow. So I guess first things first, we want to talk about is what tennis elbow is. It used to be called lateral epicondylitis, but we don't use that term anymore. Itis, as many of you probably know, itis means that there's inflammation around the tissue. So in this case here, it's rebranded opathy, so tendinopathy rather than tendinitis, because histological studies actually show that there is very little to no presence of inflammation in the area. Now, you're thinking, okay, this is like too much information for me to understand. But the reason why I want to share this is because when it comes down to what's happening at the elbow, or I guess any tendon irritation, is that if we think that there's going to be inflammation at the area, what are we generally thinking to do? Most people are thinking RICE protocol, so rest, ice, compression, elevation, which again, that's another video that we're talking to, or I've mentioned it before in other videos, but we don't use that protocol anymore. But basically, people are thinking, okay, well, I need to be taking ice to calm it down, or analgesics, so like Tylenol, Advil, stuff that kind of settle down inflammation. So the reason why it's important to understand that tennis elbow or any kind of tendinopathy isn't actually inflammation is because we don't want to be actually interfering with this by applying ice and analgesics, because in long term studies have shown that it actually reduces the efficacy of the healing process. So again, we don't want to be really using ice or analgesics in this. We really, really have to in this case. It goes along with many other injuries as well. If you can stand it, that's better than actually using these anti-inflammatories. So again, like we said, it comes down to the terminology. So it goes down to lateral epicondylopathy now. All right, so now we know what it is, or what it's called anyways. What actually is happening here? So basically what we're looking at here is the overload of the tendon. So as I mentioned, all these wrist extensors, finger extensors attach into that point. And basically what we're seeing is these tendons are being overloaded, whether that be, you're playing too much all of a sudden, you played a long game, maybe you lifted something heavy, you carried something heavy, like you're working on a cast iron pot, for example, doing a lot more drilling. In our case here, we want to keep it down to, pickleball, because a lot of you guys are watching because of pickleball, for pickleball, obviously. So, maybe you guys ended up playing a 4-hour tournament, and you had a lot of, backhand attacks, backhand flicks, blocks at the kitchen net, or at the kitchen, at the net. And because of that, you're loading up those tendons quite rigorously, maybe more than what your tendons are used to. And now what I would like to talk to my patients about quite often is the supply and demand. the nice analogy that people use in economics, and I like to use the same analogy for tendons or any kind of tissue, but in this case here for your tendons. So supply is how much strength conditioning your tendon has. The demand is how much or what you're asking these tendons to do. So when there's a discrepancy between your supply and demand, so your supply is lower than the demand that's been asked to do, for example, playing a 4-hour tournament, or a lot of you guys come into clinic because you play 6 hours a day, 4 hours a day of pickleball, and you're wondering why your elbow is hurting now. But yeah, basically what's happening is there's an increase of demand on the tissue and your supply, so the strength conditioning of your elbow or the tendons in your elbow are not up to par. And that's when we start to get irritation through the tendon. Now, we also want to know, okay, what stage is it in? Is it acute, like as in like the first few days, week into it? Is it subacute within the first few weeks? Or is it something that's chronic, so it has been months, maybe even years that it's been bothering you for? And this is very important because this kind of changes the protocols into how we approach rehab. But for the most part, again, what's going on is disc organization, maybe some irritation, overload through your tendons, and that's why you're getting pain through your elbow. Okay, so I guess a few things what I would recommend right off the get-go for these patients coming in to the clinic is, one, we need to correct that discrepancy between the supply demand, right? So what we need to do is we need to the easiest things to do right now is to start to rest the elbow. Now, I know a lot of you guys don't want to hear that, but what I think you'd be happy to hear is actually, I'm not going to say, okay, you can't play at all, or you can't play pickleball at all, or you shouldn't be playing for X amount of weeks. Most of the time when I say rest, I'm talking about relative rest, meaning right now you're playing 3, 4, 5 days a week at 4 hours. I want you to take that down to 50%, for example. So basically, I want you to cut the amount of hours, cut the amount of days you're playing, or maybe even just the number of games you're playing within the same set. Take more rest between. So I'm not asking you to completely take full rest from pickleball because I know none of you will listen to me anyways. So yeah, so just taking more rest between sets, taking more breaks in between sets, and that's a great way to kind of reduce the amount of demand on your elbow right off the get-go. So that's the easiest thing you guys can do. Other things you can do as well, again, unless you're a pro and you had to get into the play a tournament for the weekend, you can't reduce the amount you're practicing playing, and you have to get through a certain amount of tournaments or games. What else you can do to help reduce the demand on your elbow? So a lot of you guys have seen tennis elbow bands. It's almost like a strap that kind of goes around the elbow and kind of just changes the anchor point for the tendon. So instead of loading at where it attaches to the elbow here, it's actually loading more so where the pressure is going to be more centralized around where that pressure is on the muscle belly. So if I had a tendon or a band that kind of comes across here, that's where we're kind of offsetting that pressure on the elbow here. So that's another great way to really reduce the amount of demand on your elbow immediately. So resting, relative resting, using a tennis elbow band to help reduce the amount of pressure on the elbow. It's a great way to kind of reduce that demand on the elbow immediately. Okay. So what else can we do? So a lot of people say, I don't want to, I don't want to change the amount of, I don't want to bring down the amount that I'm playing right now. I don't want to stop playing. Maybe I'll take a little bit more rest, but I don't want to do too much to kind of correct it on this side of the graphic. Okay. They're like, okay, what can I do to make it better so that I can play? So again, this comes back to, okay, where are you in the stage of rehab? Are you acute phase, subacute phase, chronic phase, etc.? At the end of the day, basically what we need to do is we need to start strengthening the muscles at and around the elbow. A lot of people say, oh, I'm stretching, I'm massage gunning, I'm foam rolling, I'm lacrosse balling, I'm digging in here, I'm going for RMT, etc., which is great. Don't stop doing those things unless, however, it is flaring things up. So if it's like a recent injury and you're digging in there, I probably wouldn't recommend that. Otherwise, if it feels good, it helps to loosen up the muscle. That's always a good thing. Again, it helps to bring down the amount of pressure and the amount of pulling at the tendon at the elbow. So definitely continue doing that. But these same people, they'll come in and like, yeah, I've been doing this for months or weeks, and it feels good for a day or so, but in the long term, I'm not really getting better. Why is this happening? So this is where I tell people, okay, well, you're helping to loosen it up, which is great, again, short term, but in the long term, what you need to do is you need to increase the strength conditioning of this elbow, right? So again, back to the graph, we want to bring that supply up. We want to get the strength, the conditioning of the elbow up to par so that we can match it to what we're asking it to do when we're playing a weekend tournament, or if we're playing 4 days a week, 2, 3, 4, 5 hours type of thing. Okay? So strengthening, and there's different types of strengthening, right? So there's isometric, concentric, eccentric strengthening. Again, we can do a different video on this and specific exercises that you guys want to see in a different video. But today I just wanted to discuss more so on like pure just strengthening, and that's in the long term, that's what we need for conditioning of the elbow, and this is what we need for improving the symptoms, but also prevention for future symptoms or future injury to the same elbow. So at the end of the day, what we need to do is we need to challenge this elbow, challenge the tendons, challenge the muscles in the lateral epicondyle area. So not just baby weights of 1-2 pounds, which again, not to say that this is a bad thing, but if you're not challenging the tissue, you're not creating any environment for the tissue to have to make changes. Again, another analogy, I love analogies, as you can tell, but another analogy of that would be like, if you're learning math and you're just purely doing addition or subtraction, you're never really going to get any better. So in order for you to improve, you actually have to challenge the tissue a bit more. And so when it comes to tendinitis, tendinopathies, with pickleball elbow, again, with any other kind of tendinopathies, what we need to do is we need to challenge the tissue. So what I would generally recommend for my patients is when it comes to strengthening, again, it can be isometric, concentric, eccentric, a combination of all three. But basically what you want to be feeling is you want to be feeling a slight bit of discomfort, or even a little bit of pain is okay. So when I say from a 0 to 10 scale, 0 being like no pain, 10 being like extreme pain, like, ooh, like chopped off my arm type of thing, what you want to be aiming for is a window between 2 to 4 out of 10, maybe even 3 to 4 out of 10 on that pain scale. I call that the Goldilocks zone, right? You want to be challenging the tissue in this zone where it's going to be making changes. Because if you do too little, that's not going to do anything, right? But if you're doing too much, conversely, you're going to be causing too much irritation. So if anything, you'll be doing more harm than good in that time. So again, finding that Goldilocks zone. And usually what I find helpful is thinking about, again, 2 to 4 out of 10 on the pain scale would be really indicative of like, okay, I'm working it. I'm not creating too much irritation on the tissue, which is going to make it get worse over the long term. So again, strengthening, very, very important. And again, depending on the conditioning, depending on the timeline of injury, depending on where you are in your recovery, there's going to be different types of exercises you can do. If you do want to know these exercises, let me know. I can just kind of go over it in another quick video. But one quick thing on that is one of my favorite tools when it does come to strengthening is this guy here. No, it's not what you guys think. It is not that. Get your mind out of the gutter. It is a Tyler twist bar, or twist bar, or flex bar. Okay, different names, doesn't really matter. They're all the same thing. You can see how it's bendy, right? Come in different resistances, just like any other resistance band. You can get these on Amazon. Just type in twist bar or resistance bar online. Basically, what these do is help with rotational movements, right? So you're twisting the bar to kind of strengthen the wrist, strengthen the fingers. Again, I can go a bit more into depth in a different video, but this is one of my favorite tools when it comes to strengthening the elbow for pickleball elbow. Okay. Now, the final thing I want to talk about on this this thing, or this pickleball elbow stuff, is, again, we talked about reducing the amount of playing time, reducing the amount of irritation, deloading the elbow pretty much, but also strengthening the elbow for long-term benefit and recovery. The other thing I really want you guys to talk about is like the paddle you're using, right? And I know a lot of you guys are spending like $200, $300, maybe even $400 on your paddle. Mine back here, I'm not gonna say how much I spent on it, but the same thing, right? You want to make sure that the paddle is not causing more irritation. Like I've heard and seen many people, on Reddit coming through the clinic as well, talking about, oh, I changed from a Vatic Pro and I picked up a boomstick, and now all of a sudden my wrist, my elbow, and everything's starting to hurt, even though it's the same swing weight, et cetera, et cetera. So a lot of other variables can be involved here, not just how much it costs, obviously. So you can't just change your paddle. I know if you spent $300 on your paddle, you don't want to be buying a new one because it's causing you elbow pain. So a few things you can change on your paddle And the reason why we want to talk about paddle, the paddle itself, is because there are things that can cause more irritation to the tendon. For example, I mentioned swing weight, twist weight. The heavier the paddle when you're swinging through, it's going to have a lot more momentum that you have to slow down with your wrist. So if you're going for those overhead smashes, um, it's causing a lot of loading through the tendon if you're kind of smashing through. And again, the heavier paddle, heavier swing weight paddle, it's going to cause a lot more pressure on the tendon. Same thing with twist weight. If your twist weight is relatively low, and it's causing more rotation in your hand when you're doing the blocks at the kitchen, it's going to cause you to maybe grip a little bit harder to try to stabilize that paddle a bit more. So sometimes maybe adding a few weights, like 3-gram weights on the sides of your paddle to increase the sweet spot, reduce the twisting, or increase the twisting weight would be beneficial in this case here, right? So a few modifications you can do to your $300 paddles where you don't have to actually scrap them, and maybe try a few different things to improve it first. Another modification I'd like to recommend to a lot of my patients when they come to like paddle modification would be adding an overgrip. So sometimes we're blocking, especially those hollow, stiff feeling paddles, the blocks, the vibrations coming through the paddle. They translate from the paddle into the handle, into your hands, wrist, and up into your elbows. And because that that repetitive blocking, that repetitive stress from the impact is causing your tendons to be irritable. And so again, thinking about what kind of paddle you're having, how much resistance or how much vibration is coming through the paddle when you're blocking or making other shots. And again, ways you can kind of modify this is adding an overgrip. So like a softer overgrip or something that can dampen the vibration coming from the paddle when you're making those blocks at the kitchen. The overgrip also can help to increase the amount of circumference around the grip. So when you're gripping it at the handle, you're not having to squeeze as much. Like especially with people with larger hands, might tend to grip a little bit tighter, or you might have to squeeze down a little bit more on your paddle because you're trying to make sure it doesn't slip out of your hand. So larger grip or adding overgrip, 1 to 2 overgrips of your handle might make it easier to grip without having to squeeze down on your handle. So that again will help to reduce the amount of pressure through the elbow when you're playing. So thinking about those things as well, like I said, grip pressure. All the pros, all the teachers, all the coaches always say, okay, when you're blocking, when you're resetting, when you're playing, you shouldn't be death gripping the crap out of your handle, right? Don't choke that damn neck. Like a 1 out of 10, 2 out of 10 grip on your handle so that you're not overloading your elbow. And again, that's going to help you with your resets and everything else as well. You shouldn't be gripping your paddle that tight anyways. So always thinking about through the game, through your set, okay, how can I reset my thinking? And one video I saw previously was every point, every other point type of thing. As the game goes on, we tend to grip a little bit harder. So just like doing a little spin in your hand, or like resetting your grip a little bit when you get to the service line, or when you're waiting for waiting to receive the serve. Just do like a little spin that resets your hand. That'll help to relax your hand a little bit, and that way you can reduce the grip a little bit more. So again, just a few tips that might help with the overall picture of things. Now, like I said to everybody, it's not one thing that's causing the irritation, right? It's not just because heaviness of the paddle. It's not just because you're gripping too hard. It's not because you're weak, right? You're weak through the elbow. It's not because you're playing too much. It's like the combination of all these different things will lead to eventual, pickled elbow in this case here. So, changing one thing at a time. You don't have to change everything, and it's an information overload. But maybe change one thing at a time and see what helps. And over time, what we want to see is like the tendon becomes stronger. The tendon gets a bit more rest between games. And that way your pickle elbow will start to improve. Okay. So these are things what I would generally recommend with someone to come into the clinic complaining of tennis elbow or pickle elbow. Obviously, I'll be doing some other treatments as well. I mean, things that I generally do for these types of things, again, depending on the stage of injury. Shockwave therapy for the tendon. I might have a couple of videos on my Instagram about that, maybe on my YouTube. But I also do dry needling, and as all most of my patients know, I'm the needle guy, right? I love needling tight muscles. There's another treatment modality that I like to use for tennis elbow or pickle elbow in this case here. So a few things to think about. Book an appointment with your physio. It doesn't have to be me. It can be anybody. You need to get it assessed because we need to know, okay, what stage you're in, what's going to be appropriate for you. But hopefully the information from today kind of gives you a bit more insight into what's going on when it comes to pickle level. Just make sure you take care of that, because we don't want to be constantly irritating it, because as we know, if we don't take care of an injury, it's going to get worse. And who knows, right now, if you're sitting out 1 week, or a few days from pickleball, and if you don't take care of it, you might be ending up setting out for half a year or something. It might be a bit of an over exaggeration, but you know what I mean. You don't take care of it now, you might actually miss more games in the long run. So make sure you guys do take care of that. Okay. So any other questions, feel free to drop it in the comments. Let me know what you want to see in terms of exercises, if there are any questions about them. And feel free to kind of pick my brain if you have any. Okay? If I have any brains, right? Okay, guys, thanks again. And I'll probably do some more in terms of injuries prevention, injury information on pickleball injuries. I've been playing maybe once or twice a week now, and I can definitely understand the soreness that's associated with it. And like I said, I can then totally understand why, if I were to tell you guys not to play at all, like absolute rest, you wouldn't listen to me, because I wouldn't listen to me either. Okay? I'll catch you guys in the next one. Thanks. Take care. Be safe.